So I'm Dr. Erik Sweet. I am a comprehensive ophthalmologist at Baptist Eye Surgeons, which means that I treat and monitor a variety of eye diseases, including cataracts, glaucoma, diabetic eye disease, macular degeneration, and dry eye, among other things. Most importantly, I'm a physician who treats my patient as an individual and not just their eyes. So dry eye is a very common problem where a patient has an abnormal tear film that covers the front of their eye, while a healthy eye will have a smooth, complete, and healthy film covering the front of their eye. A patient with dry eye will have a abnormal film, either in quantity or quality, or sometimes both. There's a variety of causes for dry eye, dozens of causes, but the most common that we see would be from allergies, from aging. Just getting older can decrease the amount of tears that you're producing. Blepharitis, which is inflammation of your eyelids. Contact lens wear can cause dry eye, as well as medication use and other systemic diseases, especially autoimmune diseases. And many patients have a combination of factors that's leading to their dry eye. Similar to the causes, there's a huge variety of symptoms. So the most common symptoms that patients talk about is burning, stinging, and irritation to their eye. They report as if something's in the eye when there's nothing in the eye. Other patients say they have intermittent blurring of vision, fatigue, or a heavy feeling to their eyelids or eye strain. Other patients will have no symptoms except their eyes will intermittently tear excessively, so it's tearing onto their cheek. And again, many patients have a combination of these symptoms that may change from season to season. Many patients, when they first start experiencing symptoms of dry eye, they shrug it off, they don't seek care or administer any treatment, and then those symptoms over time become more severe, more chronic for them, and oftentimes when patients come to me with symptoms, we have a more severe condition to the eyes that requires long-term treatment. And once we have the symptoms under control, many patients will need kind of a suppressive therapy for years that keeps the symptoms manageable for the patient. The treatments really depend on the individual and the cause and the symptoms. Many patients will be okay with basic over-the-counter medication treatment. Other patients will need either a short-term or long-term treatment with prescription medications. Other patients yet will need an interventional approach. For instance, having their tear outflow system plugged up so that tears will stay on the eye longer and alleviate the symptoms of their dry eye. Yeah, so if you have concerns about dry eye, I recommend coming on into Baptist Eye Surgeons. One of our physicians can do a thorough and comprehensive evaluation of your eyes to see what may be bothering you. That's also an opportunity to make sure that there aren't any other conditions going on with the eyes that are causing symptoms that need to be treated as well. So there's a lot of information out there about dry eye. Family, friends may talk about it, as this is a very common issue. The internet is full of information about dry eye, but it's easy to get lost there. If you're experiencing the symptoms, again, it's best to come on in, get an evaluation, and get a treatment plan and education that is directed towards you, your symptoms, and the causes of your dry eye.